Hi, I want to just say a bit about the therapy space, because the time that you pay for to have therapy, or that you invest in therapy, is your space. You own that space. You own that time, and that means that it's a space where you can be a lot more of what you need to be, or what you'd like to be in that space. So things like, where most of us are private criers. We don't cry, if anybody's watching, or we sneak off to the bathroom or whatever. We go and cry on our own. Now, there are a few other people who feel safe enough to cry wherever they need to cry, and that's a whole different thing. But if you are that person who is kind of locked into that space, and lots of men particularly, the big boys don't cry has been ricocheting around their brains for 60 years. So I think it's important to actually understand that in the therapy space, that those kinds of things that we feel inhibited to do are safe to do. It's okay to do it there. Now, I'm not saying that you go to therapy just to cry, but I think that it's one of those spaces in which the relationship that you're building with your therapist or your counsellor, whatever you call them, is so that you can actually feel safe to do those things where otherwise you're going to feel judged socially or professionally or whatever. So it's worth thinking about. All of these tips that I'm doing, all these videos are just sort of a gateway to what you might do next, because if you do it in the company of someone else who kind of knows their stuff, then it can be a really valuable, nourishing way to change your life. And so, yeah, I think it's important to think about that. I also think that there is a kind of alien feeling about doing those things because we're not used to it. We're not used to it. We talk about ourselves in a way which is self-deprecating, or kind of, sometimes we are bigging ourselves up, but actually at some other level we don't really believe it. So finding a different way to be communicating with yourself is it's really valuable. And